Hello, my name is Randy Miller, and I'm a plastic surgeon in Miami, Florida. I originally did a residency in otolaryngology, head and neck surgery at Thomas Jefferson in Philadelphia, which is where I went to medical school. So I was there for 9 short years. And then I went to Baylor College of Medicine in Houston and did a second residency in general plastic surgery and reconstructive surgery and cosmetic surgery. The history is that in the 1990s, we were doing transfer of fat tissue in plastic surgery for cosmetic purposes. And we started to work with a gentleman named Dr. Sidney Coleman in New York, who is one of the fathers of structural fat grafting. Our chairman in Texas, Melvin Spira, went and spent a couple weeks with Sid in New York City and came back to Houston, and we started to do a lot of fat grafting, and we found it to be a great tool for the cosmetic patients. And at that time, we did not know that there were stem cells in fat tissue. Okay, this was in the 1990s. And after we started doing a lot of cosmetic cases, I then was on a rotation at MD Anderson, and I had women who had radiation burns from previous mastectomies and radiation therapy, particularly back in the 70s and 80s when it wasn't such a great science and they really did do a lot of damage to the tissue as well as saving the patient's life. So in MD Anderson, I started to think, well, maybe we can start to use fat to reconstruct breasts and reconstruct other areas of the body. And so we started to do that. And the thing that was so interesting to me was that everywhere that we injected the fat, this radiation burn just went away. And we had no idea how that was happening. We said, this is amazing. This lady had such a difficult chest wall that was filled with scar tissue. We inject a little bit of fat, and all of a sudden, all the radiation damage goes away. So what's happening here? And then in 2001, we discovered that there were mesenchymal stem cells in adipose tissue and fat tissue, and not just that there were some stem cells in there, but that adipose tissue is actually the richest, the most plentiful source of stem cells, of mesenchymal stem cells. So then that evolved into the world of regenerative medicine. And we say, well, if we're going to take this adipose tissue and it has stem cells in it, maybe we can start to use it for other applications. And then that led to lots of cases in the office with burn patients having their scars completely disappear and having a big impact on patients in their life. I would say that one of the other things that was so impactful was the fact that these patients were cured of their chronic pain, not just that they were being reconstructed, but that they were feeling much better as well. And so then we were doing a lot of cases in the office and in the operating room. This evolved into formal clinical trials for drugs to basically make stem cell medications from adipose tissue, from fat tissue. So we went down that pathway. That's more of a pharma pathway. It's not so much that the doctors do that in the office, but since it was recognized that there were so many stem cells in adipose tissue, that the clinical trials started, and we're getting great results. As we're learning about the science of stem cells, we learn that stem cells release these little tiny bubbles called exosomes, and the exosomes actually send signals to the tissue. In the beginning, we thought that the stem cell just attaches to the tissue and turns into that tissue. But then what we realized and learned scientifically was that the stem cell doesn't turn into that tissue. It sends out lots of messages that are contained within these exosomes, and these exosomes then stimulate the production of connective tissue and blood vessels and cartilage and bone. So in the process of growing stem cells in the lab, which is not something that we do in a doctor's office, but it is for clinical trials and drug studies, we noticed that the culture media, the fluid that we're using to bathe the cells and grow the cells and expand the cells, and then we would take that culture media and we would throw it away. And then we realized that we were throwing away the baby with the bathwater, because all those beautiful exosomes, we considered them in the beginning to be waste product. And so we were focused on just the stem cells and we weren't focused on anything else. And then we learned that, hey, it's not actually the stem cell, but it's the exosome from the stem cell that's actually having all of the regenerative capacity. So now there are lots of evolving technologies related to exosomes in particular. And exosomes are released by all cells, but particularly with adipose stem cells or stem cells from fat, that's not only the richest source of stem cells, but also the richest source or the most plentiful source for exosomes as well. So now we have to balance the regulatory environment. We need to protect the patients, but we also see that we can cure diseases. And then after that, what happened is some very important people drafted an act into Congress, which is called the 21st Century Cures Act. Okay, and this was written by Dr. Bill Frist and his colleagues. And basically, the 21st Century Cures Act allows for stem cell treatments in the United States without having to necessarily go through a clinical trial. So if you're dying in the ICU, you can say, or your family members could say, I want stem cells, and you can get them now legally in the United States because of the 21st Century Cures Act. That was drafted in about 2016. Nobody at that time knew that COVID was going to happen. Okay? Then, when COVID happens, we have all these patients at the University of Miami who are on ventilators, and they're dying of COVID, what we call ARDS, Adult Respiratory Distress Syndrome. Their chest x-rays are whited out, they have scar tissue all through their lungs, and they're going to die. And so we started doing stem cell treatments on these patients in the ICU because we were allowed to, because the 21st Century Cures Act gave us the ability to treat these patients. And what we found was the patients that got the stem cells got their lungs cured. And we have seen this over and over again. And we've seen it with stem cells from adipose tissue, stem cells from bone marrow, stem cells from perinatal tissue. And we watched this with our own eyes at the University of Miami, people literally going, instead of to the morgue or the medical examiner's office, back to their own bed with their own pillow and their own family. So we now have a very exciting pathway that has kind of developed over time. And we have good relations actually with the FDA and with regulatory bodies because we want to make sure that we do it the right way. We want to make sure that it's legal, that it's proper. But at the same time, we're seeing amazing results with stem cells and exosomes, particularly from adipose tissue. One more, I'll backtrack a little bit and say that the rules and regulations for stem cell procedures are very strict, and we follow those rules. And the rules say that if you are not manipulating tissue, you can transfer tissue from one area of the body to another area of the body, and you can do that in your office, and that's considered the practice of medicine. You're not manufacturing a stem cell drug, you're just transferring adipose tissue from one area of the body to another. So during the course of time, we had to refine our instrumentation to be able to get adipose tissue and extract it from the body with the maximal concentration of stem cells. And I started working with Tulip Medical in San Diego over 15 years ago, and they are the premier. They have been with us in the liposuction and fat transfer industry since the very beginning, and they've been very supportive, and they've helped us with new instrumentation, and they've always been very receptive. So when we started to do a lot of these stem cell procedures, we had discussions with Tulip to say that we would like to develop and design single-use disposable cannulas to extract fat, to be able to have a maximum concentration of stem cells for procedures in the office. The future of stem cells is, it's the future of medicine. It's going to really relate to all medical specialties. And we have to be able to harness that regenerative capacity, and we need to be able to take that and utilize that, with our patients. It is very interesting that in the House of Medicine, which is a very slow and stodgy body to move, many doctors do not even believe that stem cells exist. So we are having to educate the medical community, and there are a lot of naysayers, and there are a lot of doctors who don't believe that stem cells are real, but they cannot swim against the tide. And the science is so strong that ultimately all doctors will understand about regenerative medicine and stem cells, and they will accept that, and it will be integrated into the medical education process. Because remember, medical students don't get any training for regenerative medicine or stem cells. It's not even a part of the curriculum. And so how can you have something that's not part of the curriculum that's going to be the future of all medical specialties? So I think that what we have to do is take good care of the patients, and we need to educate the House of Medicine. We need to educate the other doctors and let them know that this is safe, it's effective, and that we're seeing miraculous things with stem cells that we've never seen with any medication or any other kind of treatment at all. But it's going to take some time and patience and lots of lectures and lots of explaining and lots of science, but we're on our way.